Hi, good evening, everyone. Today it's going to be a different topic. It's more like a scope of plastic surgery. A lot of people have asked me, what is there? Is there a future for plastic surgery? Is it worth doing plastic surgery? Why should I choose plastic surgery as an option? So I'll try to answer all these questions. And at the same time, this was something like searching into my own heart to see whether I have chosen the right specialty. We'll just go into the presentation. Now the agenda for the day, scope of plastic surgery, and of course the usual routine quiz question of the day. Now, I want to make a disclosure at this point. I've taken a lot of pictures from the net just for teaching purposes and for representative to show, because I don't do the entire gamut of plastic surgery, but I need to show you what all can be done. We'll deal with the scope of plastic surgery under the history, introduction to plastic surgery, the different fields, and what is the future. Now, why this talk? Why should we at all talk about plastic surgery? Because plastic surgery as such is a poorly understood specialty, not only by the public, but also some medical professionals. And plastic surgery is a unique specialty that defies definition, has no organ system of its own, and is based on principles rather than procedures. And it is not defined by anatomical area like ophthalmology or ENT or thoracic surgery. They confine themselves to that area. Plastic surgery is not confined to any area, or it is not even confined to an organ system like gastroenterology or urology. It is not confined to any patient age group, pediatrics or adolescents or geriatrics. Now, so what is this? The surprising thing about plastic surgery is, however senior you are, however junior you are, you may be asked to perform operations that you have not done before or likely to do again. So that is, in short, the essence of plastic surgery. Because every case is unique, every case is challenging, every case brings out the creativity in you. Some surgeries are standardized, some are cut as you go. Nobody knows what it is. Nobody will know. You can ask for suggestions from your colleagues or your peers or your students or your teachers, but they may not have seen that case that you are seeing. So that is what is plastic surgery. Now the word plastic surgery is actually derived from the Greek word plastikos, which means to mold. It is being molded. You are molding tissues. So that is plastic surgery. When you go into the history, we try to trace how did this funny specialty with no organ specific treatment, or with no age specific treatment, or no anatomy specific treatment, how did this come out? Now we are all aware of this name of Sushruta. Almost, it's controversial about when Sushruta was actually practicing and the period in which Sushruta lived. It has been put at around 1200 BC. And you may be aware that he was the son, he is claimed to be the son of Vishwamitra, the same Vishwamitra who was attracted by Menaka. Now, this Sushruta learned medicine, supposed to have learned medicine from Dhanvantri, who is supposed to be the god of medicine. Now, Dhanvantri is a very interesting god because there are very few temples for Dhanvantri as such. And if you visit one of the temples, I visited one of the temples near Valajapet. There, this god, this temple is actually open 24 hours. He's supposed to be a doctor among the gods. So this temple is supposed to be open 24 hours. And he has in his hand a leech. Now, a leech is something different. Leech is something that is being used in those days. In ancient times, it has been used for bloodletting, the procedure called bloodletting. And the leech is used even today in modern plastic surgery and microsurgery. That's what makes it very interesting. And the interesting part is that Sushruta has patented a lot of new instruments that could be used in surgery. And he had some special interest towards plastic surgical procedures, and that was part of his repertoire. But modern plastic surgery came into its form with Harold Gillies, the ENT surgeon by training. He worked during the World Wars. He noticed so many patients with injuries to the face. He wanted to do something for them. And that is when plastic surgery started developing. We'll just look at one of the examples of his work. He's written a fantastic book called the Art and Principles of Plastic Surgery, where he has documented all his works. Fantastic photographs. In these days, when we find it so difficult just to take out our cell phone and click a picture, he has meticulously documented all his work. So and they put a rib carpet along with the blood supply, got the excess tissue, and you can see the result. But you will also note that from the first picture to the last picture after reconstruction, the age of the patient has increased so much. So that is the time period it has taken for this reconstruction when he started off. Because he was able to do all this very carefully, making sure that there was good result, he did not bother about the time. All he wanted was a good result. So this was the beginning of plastic surgery, reconstruction. Now, I just wanted to give a small introduction to my coming into plastic surgery. People are usually, they get what do you call, they are attracted by some speciality in some simple way. When I was doing my general surgery in Madurai Medical College in the year 1991, and I was posted in plastic surgery, this Professor C. Gopalakrishnan was the professor of plastic surgery. I once went into the theater and he was planning to do a cleft lip repair. I, as a junior, as a general surgery postgraduate, I just stood behind him watching. He took out an ink pen with an ink, sterile pen, and he started marking. Patient was under anesthesia. So he was marking. It was a very small child, about, I think, 8-month-old child. He did a marking. He looked at it for a few minutes, then he rubbed it off. Then again, he took the marking again and made a very meticulous marking. And he rubbed it off again. Now this was getting interesting. I wanted to know whether this man was going to do the surgery today or not. So then I kept watching. Then he made another marking. Then he took out his knife and he asked the sister and his assistant for the knife. He started making the incision. I was called away to help in some other case. I went to assist that case and I came back to see what had happened here. And when I came here, I got the shock of my life. The whole lip was opened out like that. It was looking grotesque. I was wondering, what is this? Why has this man made it like this? How is he going to suture it now? It looks terrible. That child was looking, at least had got just a cleft lip. I was wondering, I was really surprised. Then by the time again, I had to go and write the notes for that surgery. I was called away. And then I came back. And when I saw it this time, it was beautiful. It was so beautiful. And it was like as if the child did not have the deformity at all earlier. I think that was the time when I was impressed, when that spark was there, inspired to do plastic surgery. I have told Dr. Gopalakrishnan also when I met him that he has been the reason for my choosing plastic surgery. Somewhere, sometime, you are going to get an inspiration from somebody, and this will take you into the surgery, into the field. It's a fantastic field. We'll go through this field now. Now, the thing is, plastic surgery is like a general store. We are not a niche store. Niche store where only one thing is sold. We sell everything. Everything from head to foot, from head to toe, we sell everything. Now, there are certain advantages. You are not bogged down by a single organ or by a single anatomical area. Since you are so large, you're like a general store. You can go in and choose whatever you want. Whatever you are interested in, you can choose. That is the beauty of plastic surgery. Now, the advantage of a general store is that, of a store he's talking about, you can cross-sell products. You can reach more people when you sell multiple products. And a general store is more stable because you can do a lot of things. Whereas a niche store can only sell that. Only if there is a demand for that product, people will come to it. But a plastic surgery or a general store has got a much wider range. But a general store is not brandable. That is the reason why people do not know much about plastic surgery, because you cannot brand a general store. You can brand a shop that sells only mobile phones, but you cannot brand a general store that sells mobile phones and many other electronic goods. And a collaboration with an influencer is difficult, as there are many products to promote. You cannot promote all the products. If you had only one product, you can promote it beautifully. But that is the problem. So the disadvantage of this huge size and the huge repertoire of plastic surgery is that it has got too many things in it. It is both its advantage and it's also its disadvantage. Now, plastic surgery as such consists of two major fields. One is reconstructive surgery, second is cosmetic surgery. I usually tell this a more understandable way. We all have a nose. Some people lose their nose because of accidents or malignancy or infection or whatever. When you don't have a nose, you have to create a nose. There you need reconstructive surgery. If you already have a nose, but you feel that you want it to look better, then what you need is cosmetic surgery. This, I told the example of the nose, but the same example can be given to any other part of the body. The fingers, the ears, the toes, the feet, all these. So everything will get covered under either reconstructive surgery or cosmetic surgery. Now, when I wanted to talk about the different fields of reconstructive surgery, I just went to the Association of Plastic Surgeons of India website. There they have given a classification of what are all the fields that come under reconstructive surgery. Oral maxillofacial, onco-reconstruction, hand surgery and brachial plexus surgery, genitourinary procedures, lymphedema surgery, burn reconstruction, diabetic foot ulcer, lower limb reconstruction, reconstructive microsurgery, oculoplastic, and pressure sore reconstruction. And under cosmetic surgery, we have got another list of procedures. So we shall now see these procedures one by one. A plastic surgeon can choose to limit a practice to one of these areas or practice the entire scope of plastic surgery. It is difficult to practice the entire scope of plastic surgery. Very rarely you come across plastic surgeons who do every single procedure of plastic surgery with the same expertise that others can do. Each plastic surgeons may be doing all the procedures coming under the gamut of plastic surgery, but they may have a passion for one particular field or a few particular fields that I just outlined to you. So that is the beauty of plastic surgery. You've got a wide range and you can specialize in one. You can make yourself interested in one and you can start developing on the one subfield of plastic surgery that you are passionate about. Under oral maxillofacial reconstructive surgery, we've got procedures like the cleft lip and palate surgery, trauma, fracture maxilla, mandible, facial bones, soft tissue injuries of the face, the nose, the ear, lip reconstruction, oculoplastic surgery. When I wanted to do plastic surgery because I was inspired to do plastic surgery. But let me tell you a truth. Even when I joined plastic surgery, I was not completely aware of what all is done in plastic surgery. For instance, I was allotted a seat in Kilpauk Medical College. The day before I joined, somebody told me, I was telling them I have got selected for plastic surgery. So they said, where? I said, in Kilpauk Medical College. Oh, you'll be seeing a lot of burns then. That is when it struck me that burns is also a part of plastic surgery. So that shows how wide it is. Now, this is craniofacial surgery. This is another part of the plastic surgery. Now, this is challenging. Craniofacial anomalies and plastic surgery is never a standalone. We always need to have interpersonal relationships with other specialties of surgery. Neurosurgery in this case, then you need to think about how. Now, when you look at plastic surgery, I told you it is based on principles rather than organ or age. The principles of plastic surgery basically is beauty and blood supply. Reconstructive surgery is blood supply, cosmetic surgery is beauty. When you want beauty and blood supply, you have to select one which is your priority. If you want to have only beauty, it is difficult because blood supply is the basis. But if you're going to give blood supply alone, the beauty may be compromised. Patient may not be satisfied. So we need to balance the two when you're giving it to the patient. When you're doing craniofacial surgery, it's interesting to note, we need to understand how the bones are vascularized. As a matter of fact, Dr. Sridhar, who was speaking to LGS a few weeks ago, he is able to explain beautifully how the bones of the skull can be taken out, shaped, and put back in their own place or in different places, totally changing the appearance of the face, at the same time not compromising the vascularity of the bones. So the understanding of the bones, the understanding of the vascularity is one of the most important concepts of plastic surgery. You can see the wonderful results shown in this patient with the craniofacial anomaly of Cruzon's disease. Now, a cleft lip. Now, the cleft lip, as I told you, these pictures are not of my patients. They are taken from the net. Now, this cleft lip, this is another challenging. I told you the example of how the marking is so important. If your marking goes wrong, everything is there in the planning. As far as plastic surgery is concerned, it's a plan. And you don't have just one plan. You have plan A, you have plan B, you have plan C. If something goes wrong with your plan A, you immediately go to plan B. You don't waste time there thinking about what to do next. So we call that a lifeboat. As far as cleft lip is concerned, many techniques are there. The commonest done techniques are the Millard technique, which is otherwise known as the cut as you go technique, or the Peter Randall's triangular flap technique. There are many techniques. Now, what technique you do depends on what you are trained in and in which technique you are able to get a good result. This is a case of cleft palate and a bilateral cleft lip. Now look at the deformity and the result. It is important to get back such results. But the next important aspect of plastic surgery is the treatment of the patient is not over with the surgery. It begins with the surgery. So the patient's growth is going to change a lot of equations. The growth is going to make what you did, what looked beautiful immediately after surgery may become looking very bad, or what looked very unsatisfactory at the end of surgery may turn out to look beautiful. So we need to understand the growth of that particular part of the body that you are operating on, that you are doing a plastic surgical procedure on. Then later, as the patient grows, the changes that occur in the growth of the face, when you are doing an surgery for the cleft palate, you are causing a scar. Now this scar is going to change the biomechanics of the growth of the face, and that may require surgery later. So when the patient comes to you with a cleft lip and palate, you need to make a composite plan. What you're going to do now, what you're going to do within 2 months, what you're going to do within 2 years, what you're going to do after 8 to 9 years, what you're going to do after growth is complete, during the teen years, and what you're going to do after the growth is complete. So it is going to be a series of procedures. This is another a characteristic of plastic surgical procedures. It is very rarely, is never a single procedure. It is usually a series of procedures. So again, another craniofacial surgery which shows good results. And you would have noticed that they used to say in those days that if the surgeon is going around with a camera, is usually a plastic surgeon, because all that we do is visible for everyone to see. It is not within the abdomen, it is not within the brain, within the skull, it is not inside, it's all surface surgery. So when it is surface surgery, sometimes when we do the dressings for a patient, you will find that the patient himself or the attender will try to peek in to see what the result is. Even before we see the result, the patient or the attender want to see the result. This cannot occur in any other specialty but plastic surgery, because all that we do is visible for everybody to see. Then we come to onco reconstruction, breast surgery, augmentation, and now this is another new specialty, new field of plastic surgery, reconstruction. Now, when there has been loss of part of the body due to malignancy, it needs to be reconstructed. People nowadays are asking for this reconstruction. The patient has got a right to look normal. That is one of the basic rights of the patient. So he can look normal and he can demand the surgery from us, from the plastic surgeon. So look at this patient who has had a excision of a lump, and the reconstruction has been done of the nipple areola complex to provide a more symmetric looking and aesthetic looking breast. This is reconstructive surgery, but remember, I talk about cosmesis in reconstruction, and when you're talking about cosmetic surgery also, it is important to maintain the blood supply. Now this patient has had a total mastectomy on the left side, and the reconstruction is done using a microvascular technique, that is the tissue from here. It is called the deep inferior. Now there's most probably extra tissue here. This is taken like a flap, and this is anastomosed here. The blood vessel is anastomosed here, either to the internal thoracic artery or the thoracodorsal vessels, to reconstruct a breast. As I told you, it is not a single procedure. This will require later nipple area complex reconstruction. It may require surgery of the other breast to make it smaller to be symmetrical. Symmetry is the next important point of reconstruction. Facial trauma surgery, either a major surgery like this, where you need to do a reconstruction of the tissues. Now, the next important thing I told you, with time, there are changes that occur with growth of the skeleton. With growth, with time, there's another change that occurs. The change in the fibrosis, the scar formation. As far as plastic surgery is concerned, the greatest friend of the plastic surgery is Mother Nature. The greatest enemy of the plastic surgeon is again Mother Nature. Without nature, none of our wounds would heal. But at the same time, if we have delayed, if the treatment has been delayed due to some reason, fibrosis, nature also starts her work, fibrosis sets in. That is going to make the reconstruction a little more complex. So the reconstruction should be primary as far as possible. So reconstructive surgery, think always of early, complete, definitive, primary reconstructive surgery. Or even a small injury like this. This injury, patients nowadays are demanding to have a plastic surgeon to suture these wounds. Good, because they are worried about the scar. They are aware that they will have a scar. So, but now there is nothing special about plastic surgery. Only following certain basic principles. Now we have come to oculoplastic surgery. Similarly, in oculoplastic surgery, reconstruction of the eyelids is very important. And now, when you come to reconstruction of the eyelids, it makes it a little more complex, because you need to give a skin tissue or a skin, and you need to create a tissue that will protect the underlying structure called the eye. Or if you have an ectropion like this is the trauma which is healed by secondary intention. You can make out the scar over here causing an ectropion. Now this has to be released. Otherwise, this cornea will go in for exposure and may lead to problem in vision. So oculoplastic surgery is one of the upcoming fields in plastic surgery. Then I told you about the ear reconstruction, a simple thing like the creation of the lobule. Now, it is just as I told you, blood supply. You need to give a tissue there with a good blood supply, and it will be a bonus if it is looking cosmetically good. So there are different techniques that can be done. You can see the excellent result in this patient. Similarly, fractures. We saw soft tissue injuries, even facial bone fractures. The fixation can be done. The suturing of the wounds, all this when done using the plastic surgical principles, excellent results can be obtained. Ear reconstruction for congenital anomalies, congenital anoxia, or the non-development of the external ear. The ear can be developed like this. It needs imagination. There are certain techniques that can be done, but what is important is, one, making sure that the blood supply is maintained, and at the same time, making sure that the cosmesis, the beauty of the ear, the folds, the different folds, the parts of the ear, reconstructing them. You need to bring tissue from other areas. You need to bring cartilage. So using a rib cartilage, carving it. Now that is the next step. Creativity. I told you, plastic surgeons, you need to have creativity. How do you create a ear? It looks quite simple, doesn't it? A ear. What big deal about it? Only when you start sculpting the ear, you realize there are so many beautiful folds in the ear that you have to create. It is not only creating those folds, it is maintaining those folds under the envelope of skin and making sure that the end result is as good as this. Then we come, I told you, from head to foot. And it is not just congenital problem, it is not just malignancy, it is also infections. Diabetic foot. Diabetic foot is a big problem. The prevention of the diabetic foot is the best management. However, if prevention, in spite of prevention, ulcers develop because there are changes that occur both in the microangiopathy and the peripheral neuropathy. Patient develops ulcers and goes around. Our country, we have got people who are going around with a lot of these ulcers. Management of these ulcers is mostly conservative, but there are specific areas where we need to intervene as surgeons. Now, that is another thing. As plastic surgeons, we need to intervene at the correct time. We need to decide what is right for the patient and plan for his surgery. Now, if you look at this foot, you can make out that the normal arches of the foot are lost. As long as you try to give skin cover for this, it will definitely break down because the normal arches are lost. When the normal arches are lost, the normal pressure points are not achieved. The pressure is going to be distributed in totally different areas that are not physiological. So the plastic surgery is not going to just think about reconstruction of the skin. It is going to think about, we need to think about how to offload this pressure and distribute this pressure only to the areas where it should be given and not to the areas where it should not be given. So that is the challenge of plastic surgery here. Lymphedema surgery. This is the next sort of surgery. Post-mastectomy lymphedema, post-filiary lymphedema, primary lymphedema due to congenital causes. Now, lymphedema surgery has grown by leaps and bounds. It's one of the fields of plastic surgery, but it has grown because of the advent of microsurgery and even more advanced microsurgical suture materials, microsurgical instruments. Now, what has happened, what has resulted in, you're able to visualize the lymphatic vessels and do an anastomosis of the lymphatic vessels. So, lymphangioplasty has now become the trend. In certain correct indications, if it is done, you can have excellent results. At the same time, the basic management of foot elevation in case of lower limb lymphedema, foot elevation, as I said, you can do reconstructive, great microsurgical procedures, but we need to stick on to the basic principles. If the basic principles are not followed, any number of fantastic and high funda surgery will not work. Now, this is the one of the pictures to show the surgical results after lymphedema surgery, or like this. Now we come to the next specialty called hand surgery. We have spoken a lot about hand surgery and the need for hand surgery and the scope of hand surgery. As you have seen, reattachment of a completely amputated part of the body by re-establishing vascularity is replantation. At the same time, re-establishing the vascularity of a part of the body that has been rendered non-viable, though only partially severed, is revascularization. Now, these are the dramatic parts of hand surgery, but hand surgery is going to consist of many other parts of surgery. For instance, in this patient, taking a decision. Now, when we come to hand surgery, now, as I keep talking about all these, I am talking about certain principles. For instance, when I talked about craniofacial surgery or cleft lip surgery, I told you we have to take into account the growth of the patient. When I talk about different fields, I'm talking about different principles, but all the principles are applicable to all the fields. For instance, in hand surgery, decision making is a very important thing, a very important concept that has to be followed in plastic surgery. For example, if a patient has lost a thumb in an injury, it can be reconstructed in many different ways. But the patient is not going to tell us, kindly do a toe transfer for me, or kindly do a groin flap for me. He's not going to tell you this. Here, we need to take the decision. We need to take the broad decision and then tell the patient the pros and cons of each so that he is able to take the final decision. Here, so you as a plastic surgeon will be taking a major decision regarding his treatment, and so it is almost like you are playing a part in his life. That is important. So unless we are aware of all the options, unless we are skilled enough to perform all the options, we will not be giving those options to the patient. So hand surgery is where you have to take the decisions, and hand surgery is the next place where you need to deal with different issues. For instance, if a replantation, for instance, this patient, when you're going to put this back, you need to deal with the bones. You need to deal with the blood vessels because you need to do a microanastomosis. You need to do an anastomosis of the artery. You need to do an anastomosis of the vein. You need to repair the soft tissues. You need to do a skin reconstruction. If there is a skin loss, you're not able to close the skin, you need to put a skin graft or a skin flap. So you need to be versatile in dealing with skin, the vessels, the repair of the nerves has to be done, the repair of the tendons has to be done, the repair of the skin. So as a plastic surgeon, you need to be versatile with handling different tissues because you are handling skin tissues from the head to the foot. You may need to deal with bone, you may need to deal with nerves, you may need to deal with the blood vessels, you may need to deal with the skin. So versatility is the other name of plastic surgery. Now we come to reconstructive microsurgery. Now, microsurgery, when it came into the field, people realized that you can take any part of the body, detach it from there, and put it to any place that you want and reconstruct that part. Now that made it very attractive. That made it more interesting because you could take away from anywhere. You wanted a thumb, you can always take the toe and put it here. You want a big blob of tissue, you can take it from the thigh along with its blood supply and put it here. So that was reconstructive microsurgery. Again, creativity is important. Now look at this example. the patient has had the middle ray was excised. The index ray needs to be moved ulnarwards, and the second toe with an interposing is taken with a bone graft on top of the middle phalangeal base. Okay, so what happened? So this was excised, this was moved there, and this part, when you moved it here, it was still only half. You need to create some toe here. So what he did was, this surgeon, what he did was he brought a second toe here. Now look at this reconstruction. Now, it is one thing, understanding the principles, I can do a toe transfer, but only if I apply my mind, only if I'm able to imagine what I can do with this. Just closing this stump will have absolutely no function. Just giving a skin flap for this, no function, no cosmesis. The thumb is intact. So even though the two fingers are intact here, half a finger is intact here, and the thumb is intact here, the surgeon has imagined, has tried to bring back to the original, has tried to bring back as much to the original as possible. And that is indeed a challenging phase. Or look at this patient. Now here, if you look at this patient, you just keep looking at it, you examine. As I said, the basic principles are most important. Whatever, whether you're a great microsurgeon or whether you're a great plastic surgeon, whether you're a great cosmetic surgeon, the basic principle is examination of the patient. Getting a good history and a good examination, nothing can beat those. Still, there's nothing to beat those important principles. The index and ring fingers are not viable. So you make an inventory. What is not viable, what you want. So the index and ring fingers are not viable in this patient. The amputated middle finger that is not shown here in this picture was not replantable. So that option is lost. However, this index and mid finger, this index finger was not viable. It was a source of bone graft for the thumb. It was a source of non-vascularized osteochondral graft for the ring finger PIP joint. So you're able to take the joint, you're able to take the bone, and you're able to take the nerve graft from that non-vascularized finger to try to reconstruct. And what was the result? Now we are interested in seeing the result. Yes, what seems to be plausible. So what happened after the reconstruction? Now look at that reconstruction. That is what gives the satisfaction of a microsurgeon. Seeing a functional hand. Getting back form is one thing, getting back function is the more difficult thing and more challenging thing. Now look at this patient. It looks like nothing can be done. The child has lost one complete half of the hand. It is called a radial hemiamputation. The remaining little finger is also badly damaged. Can we just leave it like that? Or just can we just put a skin graft? It would result something like this. This is not that patient, but something similar has been done for a similar injury, and this is the result, a totally useless reconstruction. The skin cover has been given, but what is the function? Zero function. However, for the same patient, if you plan for a ipsilateral toe, if you plan for a gracilis muscle, or if you plan for contralateral great double toe, what would be the result? This would be the result. So it is imagination and technique. Your skills are also very important. Mostly it is the imagination that you can do it, that your attitude is to getting back a functional hand. And that is one of the charm in reconstructive microsurgery. Lower limb reconstruction. This is also an interesting part. Now, when there is a lower limb reconstruction, when there are associated fractures, there it is the orthopedic surgeon who sees the patient first. But the plastic surgeon also must see the patient, because the bone reconstruction, the bone fixation can be done early. But the skin cover is also important. Without the skin, the bones, however beautifully done, will not withstand time, the ravage of time. They will go in for a necrosis. However, if there is a bone, there's a fracture, and a skin cover can be given, the bones can be protected, and fixation can be done later. Now, this is a patient. This was our patient who had a partial amputation, young girl who had a road traffic accident. So we did immediately a microvascular reconstruction to protect that limb. So we are able to give a good limb. Similarly, a skin loss, a major skin loss like this, an infected wound can also be reconstructed to give back a good reconstruction. As I said, we were also talking about reconstruction, encore reconstruction. When you've got a malignancy on the face, the reconstruction must be done as early as possible so that we can get back good function. The mandible, when the mandible is resected, it can be reconstructed with a fibula. Microsurgical techniques have revolutionized the reconstructive surgery. It could be a small procedure like this, a small malignancy, a basal cell carcinoma, which can be reconstructed like this. Similarly, hand surgery and brachial plexus surgery, genitourinary surgical procedures. The genitourinary procedures that are done in plastic surgery are usually hypospadias and sequelae surgery, sex reassignment surgery, male to female or female to male. Hypospadias surgery is done by pediatric surgeons, by urologists and plastic surgeons. The basic aim is to convert the urethral orifice to the tip of the penis. This is very important. It is important because the patient does not have to urinate sitting down. He can urinate standing up so that he can have a stream from the tip of the penis. So this aim must be understood. Burn reconstruction, acute burns. Burn reconstruction is the next important part of plastic surgery. Here, the priorities are totally different. Getting back the patient alive, getting back, reconstructing different parts of the body at the same time. For example, this child with an electrical burns had sustained injuries on his scalp, on his hand, right hand, on the shoulder region, on the left lower limb, on the foot. He has got, this is a typical of electrical burns, and you can make out the reconstruction. Flaps have been given for the scalp and the right hand. Skin grafting has been done for the lower limb. You need to decide. Now here, triage. That is the next part of when trauma is the factor. Burns is also a part of trauma. Reconstruction becomes very interesting because you need to decide on which you're going to reconstruct first. Whether you need to reconstruct the skull first, the skull raw area, or the hand raw area, or the lower limb raw area. So there, it makes it interesting. Or it can be challenging, like this patient with an acid burn. You can make out the amount of damage to the skin and the amount of loss. That becomes, so plastic surgery is not just taking this much of tissue. It sometimes involves so much of tissue to resurface the entire skull. Or a child like this with a 60% burn, you can see the child begging you to save it. We lost this child, but that is how it is. So plastic surgery is on, I'm talking about the exciting part of plastic surgery. Saving this child is a challenge. There are different techniques that you can use to save this child. We must try to use all these techniques. We have seen diabetic, now we'll come to Ulcoplasty. Reconstruction of the penis. It can be done either by using microvascular technique. You can take skin from the forearm to reconstruct the penis, or you can take the skin from the lower abdomen to reconstruct the penis. And lower limb reconstruction we have seen, and oculoplastic we have seen, and pressure sore. Now we come to the second part of plastic surgery, which is cosmetic surgery. We have got different fields. Botulinum toxin, where you have folds, you have got furrows. You can see the crow's feet in this patient. You can see the crow's feet wrinkles here, which can be obliterated with the botulinum Botox, as it is called, or injectable fillers. You can now, when you have a sagging of the skin, what happens? The shadows become more pronounced. You don't want those shadows, so you want to make it look more smooth. To make it smooth, you inject small amounts of substance to make it to smoothen out these sharp shadows, and you get a good appearance, good looking appearance. So injectable fillers like this in the nasolabial crease, you can make out the deep creases which are ironed out here, or like in this patient. Now we come to the breast surgery of augmentation. A small breast, patient wants to look larger. Augmentation can be done either with autologous tissue or with implants. Breast augmentation, here is another example to show the augmentation. The satisfaction that the patient gets is most important. Or breast reduction. Breast reduction is not just a cosmetic surgery. The weight of the overhanging breast can sometimes cause problems like pain in the neck or pain or scoliosis. Now, kyphosis. Now, this is important. The reduction of this breast can be done, but there are important things to be followed. The blood supply of the tissue must be maintained. You must maintain the sensation of the nipple area complex. You must also maintain the integrity of the nipple areolar complex when you are reducing the breast. There are different techniques that have been described, each with its own advantages and disadvantages. In males too, gynecomastia is a very common procedure. Surgery is a procedure, and you can do a surgery or a liposuction. Similarly, mastopexy with augmentation. Mastopexy is breast lift. Breast lift along with augmentation can be done. Fat grafting. Now you can make out the amount of fat that can be injected. Instead of injecting chemical, you can always inject fat into the folds so that you can get an ironed out look. The chin can be altered with procedure like Genioplasty. Or importantly, what made plastic surgery look so glamorous, the Rhinoplasty, that is the shaping of the nose. You can make out what may look like a small change is a big change that is appreciable by the patient and by the people who are looking at the face. The nose forms the central part of the face, and the first part of the face that comes to be seen by the onlooker is the nose. So the modifying the nose can be done with a minimal of scar formation. So that is the beauty of rhinoplasty. Similarly, in this patient. Then the abdominoplasty. Abdominoplasty also is it's a very commonly done procedure which brings both the anterior view and the lateral view. Now we come to another important procedure. Now we have got a lot of bariatric surgery. Obesity is another problem that is in society today. So with obesity, what we need to do is bariatric surgery, where there will be a massive weight loss. Once there is a massive weight loss, you will find a weight loss hanging folds of skin. So after massive weight loss, we need to do a body sculpting so that all these folds can be taken away. Just a weight loss will not cure the problem, because a patient who has been obese, when they lose a lot of weight, you get a overhanging folds of skin which must be corrected. So this is procedure called the corset trunkplasty, where you go all around the body, remove the fat, hanging fat, make sure that there is no loss of blood supply, make sure that the safety of the patient is most important. While doing major surgery like this, we always tend to underestimate the loss of electrolytes and the fat that is being conducted. Facelift procedures, the commonly done procedures, the brow lift, the thread lift, and of course the hair restoration. Hair restoration is also important. The hair is very important to the psyche of the male. So here again, another example of a hair restoration. And male-specific plastic surgery like penile implants. Now, penile implants also are important. People with erectile dysfunction. And now what is becoming more popular is vaginal rejuvenation or female genital plastic surgery. Women want to look more young. It's not just the face or the breasts or the hands or the limbs that need to look young. Even the genital organs need to look young. And this is an upcoming field of plastic surgery. So if you look at all the features of plastic surgery, there are certain common features that we need to understand before you can decide whether you want to do plastic surgery and what is the scope of plastic surgery. It is a broad specialty. I told you it's like a general store. It's a broad specialty. The learning curve is more. If you need to understand so many procedures and see so many procedures, you cannot learn each and every flap surgery or every microvascular surgery or every cosmetic surgery during your residency training. It requires patience and precision and skills. But most importantly, you need to understand the concepts. You cannot do every surgery. I told you, after you finish your residency, when you start your practice outside, the first patient that comes to you will be a case that you have not seen in your entire 3 years of your residency in plastic surgery. Second, private practice. It is actually easy to establish a role as a sole runner in metropolitan cities or in tier 2 cities or even in the periphery because you are dealing with trauma. You must remember that you will not get cases for you as a plastic surgeon at the beginning. It will only be a referral practice from general surgeons, onco-surgeons, orthopedic surgeons, pediatric surgeons for the first 5 years, and it will be mostly trauma. And you will also have competition from seniors in this field in this period. Type of surgery, as we have seen, it involves a wide range of surgeries. You can have flap surgery and microvascular surgery on one side. You can have hair restoration surgery and burn surgery, which are also very tiresome. You can have small surgery like trigger finger release or suturing of the tendon, which are more precise surgeries. So you may have long hours, you may have skill-based surgeries, intense work in phases. For instance, when you're doing a microsurgical procedure, the entire 5 hours is not going to be an intense surgery. There are some hours, there are some parts of the surgery where you can just breeze along, where I usually have the music on and we listen to good music. That is why plastic surgeons do most of their surgery sitting down. There is no hurry. What you want is a good precision. What you want is a good result. To achieve this, and what you need to be is you need to be patient. So it is best to sit down and do the surgery. Meticulous post-operative follow-up. You may do a major surgery for 5 to 6 hours. You may be called back after you reach home saying that there is a problem, you need to get back. And you will realize that the patient, your work on the patient starts with his surgery and goes on till the patient is completely rehabilitated, which may take several years. Emergency is the lifeline of reconstructive surgery. Limb or finger replantation, tendon surgeries are emergencies that the plastic surgeon faces in initial practice. But plastic surgery is not as hectic as neurosurgery. An emergency can be delayed for some time within the golden hour. You can always do it later. But remember, primary surgery will get you the best results. If you are thinking of cosmetic surgery, yes, cosmetic surgery, you can follow up from the beginning. But remember, all the concepts of plastic surgery must be understood before you venture into cosmetic surgery. That is why people who are not trained in plastic surgery falter when there are complications in cosmetic surgery. Corporate practice. There are not many positions for plastic surgeons in corporate hospitals compared to urology or surgical oncology or gastrointestinal surgery or neurosurgery. So getting a patient being primarily referred is rare. And you may have to work under the shadow of a senior surgeon for a few years before patients start coming to you as a plastic surgeon. overlap. Now, this is another problem in plastic. It's there in every field. There is stiff competition in cosmetic surgery like hair transplant from dermatologists, cleft lip surgery, pediatric surgeons do it. Some of them do it quite well also. Hypospadias from urologists, etc. There are no walls between specialties. We should remember this. You are not the owner of hypospadia surgery. Similarly, the urologist is not the owner of hypospadia surgery. You do it well, you get your patients. What your aim is, you do. The patient who comes to you, you need to do it well for him. And the patients will choose. They realize that the basement of plastic surgery, the surgeon who has had the complete basement of the principles will do the best surgical procedure. And what is the future? There is growth in cosmetic surgery, in oncoplastic surgery, in transplant surgery, in reconstructive surgery, in lymphedema surgery, in cleft lip and palate surgery. There is growth. Future is there. So the final verdict, opt for plastic surgery only if you're interested in the field. I have shown you the different parts of the plastic surgery. It's like a general store. You can select whatever you want, settle with that one thing, but you need to come into the general store to see what all it can offer. By working close with an onco surgeon or a general surgeon, you can get a good referral. You can start doing the different procedures. Competency in plastic surgery needs basic knowledge, surgical judgment, technical expertise, ethics, and interpersonal skills. So, it offers a flexibility in lifestyle. If you have taken up plastic surgery, you can enjoy a thriving practice in either academic or private practice setting. You can have an exciting and unpredictable lifestyle if you're going to go into trauma-based plastic surgery. If you want a controlled lifestyle, yes, it is there in plastic surgery. You can do breast reduction or cosmetic surgery. If you want to do academic research, yes, regenerative medicine is the next upcoming part. It is one of the fields closely related to plastic surgery. So the future, we've got existing challenges. Reconstruction after trauma, burns, and cancer is still not completely cured, is not completely solved. There are still challenges, existing challenges. There are upcoming challenges like stem cells. There are upcoming new fields like regenerative medicine. You grow a ear on some part of the body, take it and put it back for him. That is regenerative medicine. Tissue transplantation, composite tissue allograft. It involves microvascular anastomosis, drugs to prevent rejection, single organ transplants, composite tissue transplant. What is needed is immunosuppression. Remember, it is very easy to take a hand from a cadaver and put it for the patient. But you need to have immunosuppression, which has got metabolic complications, infective complications, and malignancies. Hand transplantation can be done. Face transplant can be done. So you can get good results. What else can be transplanted? The uterus can be transplanted, the larynx, the knee joint, abdominal wall, left to your imagination. All this comes under plastic surgery because basically you need to anastomose small vessels. You need to anastomose the vessels and take care of the tissues till it starts functioning. So the abdominal wall can be transplanted like this. The uterus can be transplanted. It has been done. It has been successful also. So this is the, so can we transplant the head? Yes, people are thinking about it, but it had already been done earlier. In mythology, it was proved a heterotransplant. Now the future, transplantation of tissues and composite structures, better immunosuppression drugs which are safer, which will make it even more comfortable. If a patient has got a skin loss of about 10 centimeters, go to the shop, get a skin for a 10 centimeters, put it for the patient and forget it, provided the immunosuppression is made much safer. So what is the scope for plastic surgery? As long as there are congenital anomalies, as long as there is trauma and burns, as long as there is cancer, as long as there are degenerative conditions, as long as there is infection, as long as the human mind craves beauty, there is a great scope for plastic surgery and all its subfields. I have a dream. A dream was materialized when Leonardo da Vinci in 1490 thought about making man fly. And it came to light only by the Wright brothers in 1903 when they made the airplane. There is another dream that is waiting to be materialized. It is a request to my colleagues. A 33-year-old craving. Bert Brent, a plastic surgeon, thought about thoracobrachial pterygoplasty powered by muscle transposition flap. What is this? He talked about the way you can make a man fly. He saw the birds, he analyzed their organs, he analyzed what is needed to make the man fly, and he made the complete blueprint. The blueprint is ready. It needs only a young and interested and creative plastic surgeon to do it. Everything is ready. So which one of you is going to make this plastic surgical dream come true? Thank you. And of course, we'll finish off with the quiz question of the day. What is this condition? You can make out a swelling there on the tip of the finger, and after pressing it, it sort of collapses.
Venous malformation, sir.
Very good, venous malformation. So the questions are, what is the diagnosis? You have answered. What is the pathognomonic feature on X-ray?
There'll be phleboliths.
Good, phlebolith, excellent. So venous malformation and the pathognomonic phlebolith on X-rays. The next session will be on common flaps. I'll start with the groin flap and the abdominal flaps. Yes.
Is there any place for questions and comments, sir?
Yes, questions?
Yeah, Dr. Dara.
Yes, sir. Am I
Yes.
audible?
Yes, madam.
Sir, I have done my MBBS and I am in the timing of like DNB counseling right now. So round 1 is there. So I am a DNB aspirant because I've got a lower rank, but I'm interested in plastic surgeries as of now. So I came here to know about what it is all about and to learn whether I will see myself as a plastic surgeon in the future. So I wanted to ask that as of now at my age, should I take DNB 6-year course or not? Like, do you think it's fruitful?
Yeah. Now, it all depends on
rather than wait like having an MS degree and then or DNB general surgery and then go for the DNB SS or like NEET PT or whatever is there.
Yes. Now, the only difference between the two is when you're doing an MS and then you're doing a plastic surgery, while you're doing your MS, you have a very strong grounding in general surgery. The strong grounding in general surgery is very important for your plastic surgical career. Okay. So the plastic surgical procedures are all based. Surgery is the basement on which you build plastic surgery. And the plastic surgery is the basement on which you build cosmetic surgery. So if you are decided about plastic surgery now itself, you can be focused and go into DIP-NB. DIP-NB in plastic surgery, the integrated 6 years,
yes,
DIP-NB, there you will go through a period of general surgical training also. Okay.
Yes, sir. I read the NB guidelines also about the course, first year, second year, and everything.
Yeah, you will go through general surgery also. So
yes,
you will have a good grounding. So the whole thing depends on whether you are focused on plastic surgery. If you are focused on plastic, the problem about the MS and then the MCH is after you finish your MS, you may again have to wait for a period of time. Okay, it's the same 6 years. But as far as the recognition of the degree is concerned, I feel that the same recognition is there for DIP-NB and for MCH. So I think if you are focused on plastic surgery, I would advise you to go into DIP-NB.
Thank you, sir.
All the best, Dara.
Thank you so much.
Any more questions? Sir, I have one question from my
Yes,
side.
sir. Yes, sir.
I mean, I was just looking for a slide where you're going to say that this will be a very suitable super specialty for lady surgeons. You didn't say that.
Lady surgeons. Yes. Um, I don't know. I mean, it's very feministic if I say that ladies are more creative. They may beat me up. Now the thing is, we have got great lady surgeons, plastic surgeons, both in our country, in our own state, and abroad. It's not that I don't know nowadays. Actually, I find that in the beginning, the number of lady surgeons in plastic surgery was very limited. Now I find more than 50% of the people joining plastic surgery are ladies. So maybe they're coming to what you are talking about. Ladies, it's more suitable, or are they more suitable for plastic surgery? What is it that you are trying to say, sir?
I'm not trying to say anything because
Sir, I think the perspective for ladies in the plastic surgery would be the kind of the lifestyle that they want to choose would be more, because of general surgery, if they take up and then they go for MCH and everything, so people say that more hectic hours are there. So if they want to have a flamboyant lifestyle, they can also pursue that, and if they want to have a hectic kind of a lifestyle, they can pursue that. So there are options available.
Yeah. So when a lady takes a plastic surgery, see, ladies have got another important role to play.
Yes, sir.
Their career is one, and their personal life is another important career. Taking care of the family, whatever said and done, even though you say they're equal, the partners, the role of the lady is much more than equal. They are more than 75%. So when they take up plastic surgery, they have got an option. They can either go into it or retract a little so that they can have a very laid back lifestyle, taking care of their family, at the same time having a good plastic surgical practice. With the other specialties, they may not have that much of leeway there. Maybe
Yeah.
that is why the reason why it may be suitable for ladies.
Yes.
yeah, Dr. Gaurav Shetty, you want to ask a question?
Sir, my question is this, sir. Once we have done with our plastic surgery training, is it advisable that we work first, or we directly go to a fellowship that we are interested in pursuing?
Yes. Now, when you have finished, please remember, after you finish your plastic surgery, I told you, isn't it? You cannot see everything in your 3 years, but you have learned the concepts. Once you come out, please remember the first 5 years is very crucial to your later career and profession. The first 5 years, you need to, I would not advise starting off practice immediately. I would advise going into your niche. You have seen the general market of plastic surgery. You have realized by the end of 3 years what you are passionate about. I would advise you to go into a fellowship. Get trained at a good center. It's not necessarily international center. Even in the national level, you've got fantastic centers which are niche. For instance, hand surgery or microsurgery or onco reconstruction or cosmetic surgery. All of them have got centers here. I would advise you to go for a training, not for 5 years, 1 or 2 years, so that you grow that passion in that field. And then I would advise you to grow into practice. That is what I would advise.
All right, sir. Thank you, sir.
So any more questions, comments from the audience? But if there are none, this is a wonderful lecture, sir. I really enjoyed it. I wish every super specialty will market their specialty like
Marketing.
I think every MS General Surgery student should see this lecture, and I'm sure a lot of them get converted to plastic surgery.
Thank
Thank
you.
you so much for your time, sir. I will see you
Bye.
next time. Thank you.